There are some questions addressed to Dr. Gambacciani. One of our audience wants to know the follow-up, combined erbium follow-ups of the patients treated with combined erbium YAG and YAG therapy. I think he or she is asking for the superficial pain during intercourse, sexual intercourse. Do you have long-term follow-up?
Thank you for the question, but unfortunately, I don't have a long-term follow-up with the combination of erbium and neodymium together, because we started a few months ago to start. We started 1 year ago with the both wavelength together for the superficial dyspareunia. But actually, I don't see any reason why the effects shouldn't last like with the erbium alone. And also, we do have the experience in the aesthetics when women, they are repeating neodymium treatments for aesthetic reason every year. And therefore, actually, I suppose, I don't have data, that also the effects on neodymium on the vulva are lasting at least 6 up to 12 months. But we'll see in the future. This is one of the tasks that Vela has to cover.
Related with this question, Marco, I want to ask you another one. Have you tried to treat the patients, young patients, especially young cancer patients, to improve their sexual life? Because we have a lot of young patients treated with radiotherapy or chemotherapy, and their vagina looks very atrophic during the vaginal examination, and some of them, they don't want to use, they are very reluctant to use estrogen or any other kinds of treatment. So did you use them erbium YAG laser treatment at all?
Yeah.
Do you have experience?
We did study a group of breast cancer patients. The youngest, she was 37. And we published the data on menopause back in 2015, and showing that we can get the similar results than with the postmenopausal women. And also those data I reported tonight on sexuality. The first data on sexuality I reported were obtained in some 25 women that were breast cancer survivors. So definitely also the breast cancer survivors, even if they are treated with GnRH agonist or aromatase inhibitors or the combination of two, they are responding to the erbium YAG laser. Maybe you need in some women not 2 or 3 treatments, but you need 4 or 5 treatments, mainly for the superficial dyspareunia, where the collagen synthesis is really jeopardized by the hormonal treatments. And for that reason, I suppose that the combination of erbium and neodymium are of help. But definitely we did obtain the results also with erbium alone.
I had a patient which is operated because of cervical cancer, and she received radiotherapy, vaginal radiotherapy, and after that I treated 3 courses of vaginal erbium intimalase, and I got wonderful response.
That's
wonderful response.
Also in patients, if I may, Tamer, also in patients that they got the radiotherapy for colorectal cancers.
Yep.
For colorectal cancers, the results with the vaginal erbium laser are astonishing, beautiful data.
Yes. One question for Dr. Fistonic, Ivan. Our audience is asking if you use estriol cream between laser sessions.
Generally not, because the effect of the laser is not only retracting the collagen, but also dilation of capillaries, which will produce better trophism and will produce better lubrication. So I do not need to use estriol cream during our treatments. But I would also like to add on the last thing that you raised, that we should stress really that gynecological cancers are not the obstacle for laser treatment. Am I right?
Yes, yes, for me. What is your comment, Zdenko?
You mean regarding the contraindication?
Yeah.
Well, in fact, we have a list of contraindications. Some are absolute, some are relative, which are left to you doctors to decide. But in fact, there is no obstacles to treat patients. The only issue is that as there were no studies done on this kind of patients, if anything happened with the patient who was before having cancer and then he was, let's say, healed either by surgery or however else, and after laser treatment through some time, some cancer came back, this patient can claim that this is because of laser, although without evidence. So this is one precaution which you have to be aware of, that this patient can be delicate in this sense. So if you decide to treat anyhow, please get a consent by this patient, explaining all the possibilities that they will not come after 5 years and said, because of your laser, I get cancer back.
Would you like to comment on use of estriol cream or estrogens before the treatment of genitourinary syndrome of menopause? Would you like to comment on the use of estrogen cream before the ErbYAG laser treatment, Zdenko?
Well, as you remember from the first study, which was published by Dr. Adrian Gaspar about the GSM treated by laser, he was doing a kind of preparation of patients for 2 weeks with estriol to prepare the very atrophic mucosa to a little bit better situation before entering with the speculum. So these two things are not excluding one another. Of course, it's up to patient, but this kind of preparation could be, let's say, helpful in a sense that these very severe cases of atrophy easier, let's say, survive the laser treatment, installation of speculum. But after our introduction of glass speculums, which are much gentler, I don't see really the need. And as I know, not really many people are doing this kind of preparations. You can tell by yourself, or maybe Marco and Ivan, are you doing these preparations or not?
No, I said I'm not doing this because we have here results from the breast cancer patients that are not allowed to use anything, and we have the same effect. Am I right,
Okay,
Marco?
but
Yeah.
I believe discussion was broader population, not just breast cancer. So.
Yeah. But on the other hand, the even data show that premenopausal women are having a better response in terms of urinary incontinence than postmenopausal one. So it means that estrogen may help the effects of erbium laser, at least in collagen remodeling. On the other hand, the estrogen improve collagen and improve collagen remodeling. And therefore, in severe cases, as I said, an integrated approach with the erbium laser in the middle, with that is in my mind today is the leader for the rapid improvement of vaginal atrophy. but it can be of help also to treat the women with hyaluronic acids or vaginal estriol or whatever, if the conditions are very severe, as you said. And they are not in conflict. They can help each other.
Mm-hmm.
Ivan, I would like to ask you, in your opinion, is it necessary to do some sophisticated investigation, neurodynamic investigation, to establish the diagnosis of ICD before starting to do intraureteral ErbYAG laser?
I mean, this is a good option to underwent these studies, because you will find out what was alpha leak point pressure here. And if it is less than 60 millimeters of water, you will easily go on with the procedure. But on the other hand, it has been proven that if you are dealing with severe incontinence where ICIQ score is more than 16, then you can easily use it. So in this case, urodynamic investigation is an option, but not in the very well situation of stress urinary incontinence where the lady coughs and I don't know.
Okay. And what do you say, Zdenko?
Yeah, I just wanted to add a comment. So through time, through these 10 years, we came to some kind of suggestion that we would treat both ways every patient with incontinence, especially the older one. Because as you well know, the atrophy of sphincter is happening to any lady. So it is always combination. It's never the clear situation, just let's say stress urinary incontinence of genuine type due to hypermobility, but there is always also a sphincteric component. And this sphincteric component is growing through the time. As we can see in GSM patients, there is always this urinary component. So our suggestion is to use both in these older patients. You can do even in the same session, do firstly intraureterally and then intravaginally. And in fact, we are now running the study in Canada. It's a multicentric randomized controlled trial where we have 3 groups of patients. One is treated just intravaginally, the other with just intraureterally, and the third with both. I hope next year the study will be finished and we will see the influence of intraureteral treatment. So far, whoever of our users were using it is quite happy with great results and with practically no side effects. And just to add, if you treat patients just intravaginally and you have some non-responders, as Ivan said, let's say 10-15% of patients, you can treat them intraureterally just to see if maybe you missed ISD because you didn't do urodynamics.
Yeah.
Urodynamics is expensive and unpleasant for the patient. So a lot of doctors our users will not do urodynamics. But in this way, when they treat just intravaginally and there is no improvement, if they then treat intraureterally, they can get significant improvement if the ISD was the issue.
And there is another question to the contributors. Do you prescribe any vitamins or supplements like vitamin C for laser treatments in order to support the collagen synthesis? Do you have any experience? Ivan, yes.
Marco was first. He wanted to
Okay, Marco.
I usually prescribe, sorry for my dog.
Oh.
I usually prescribe estrogens in severe cases, when I can. When I can prescribe estrogens, I do prescribe estrogen locally or generally. And I will prescribe the hyaluronic acid suppositories. I know that Ivan Gaspar is always prescribing vitamins and supplements in post-menopausal patients. This is not my common way of doing.
There is another question. Sorry, Ivan. I didn't get your answer.
In this case, I do prescribe something which will enhance vaginal flora. like a lactobacillus or something like that, because you will have a whole situation on a higher level if you have right pH in vagina. So why not?
And one question about the urethral prolapse. Do you treat the urethral prolapse? Do you have any experience? The prolapse, urethral prolapse treatment by YAG laser. I have no experience actually by myself. Do you have any experience, Zdenko, Marco?
No, I don't. I don't have
Urethral prolapse, urethral prolapse.
I must say that we got a few questions about this from some users, but as you all three don't have experiences, I didn't find anyone who was treating it. So to be honest, we don't have answer in this moment.
Okay. And you mentioned about treatment of recurrent urinary infection by YAG laser. Would you explain us the mechanism behind the treatment, Zdenko?
Well, I think it's the heat working on these organisms like fungi or bacteria. In aesthetic, in dermatology, we have a treatment for onychomycosis with YAG laser, which we are increasing the heat under the nail. And we are pushing this fungi into the apoptosis, in fact, because we are not increasing the heat to the killing level, because it will be too difficult for patients as well. So we just increase to 45 degrees centigrade. And if you do this like a thermal shocking of this fungi several times, which means several sessions, they found this, let's say, surrounding unpleasant, and they go to apoptosis. It was proven through histological, mycological findings under the nails and so on. So I believe this is the same effect of the heating with superficial heating with erbium on vaginal wall, where this fungi are sitting, and this thermal effect is actually causing the apoptosis of them. This is what we found from the other field, but it also applies for this application, I believe.
Okay.
Doctor, just maybe a comment. Dr. Gaspar presented, it was not published yet, but he presented a 1-year follow-up on patients with candidiasis, where he achieved a very nice clearance of practically all patients. And he also did in vitro irradiation of these fungi colonies on agar. He irradiated them with erbium laser with the same settings as he's using in vagina, and he showed the decrease of these colonies after irradiation.
Okay.
So Zdenko, so he used the same settings as we use for, let's say, internal ace or something?
I don't know by heart, but it is very similar. And the thing is that you have to irradiate the full vaginal canal, including the fundus or fornix, because when we treat atrophy or incontinence, we do circumferential and we put emphasis on anterior wall because we are going after connective tissue. But here, when you have this microbiota, you have to treat the full, whatever you can see, because if you have some pockets and they can hide, then of course you didn't do a proper job. So this is a difference, that you have to treat everything.
So you're not doing that blindly as we do these procedures. You have to dilate by speculum and then.
Well, I believe he do this in 2 steps. The first step is to do circular as we usually do, because this is the majority. It would be like 90% of surface. And after that, of course, to go and shoot down to the fundus.
To the fornix.
Fornix.
And there is another question for Marco. For the introitus pain, superficial pain, do you use PRP?
No, I don't have experience with the PRP. I know that some colleagues, they are using PRPs for vulvar problems for lichen, for example. They are using PRPs. I don't have experience with PRPs, and is an option. I cannot say anything more because I don't have experience on that.
Zdenko, would you like to comment on it?
Yes, I can comment that some people use it even regularly for atrophic situation, not only on superficial dyspareunia, but also intravaginally. For example, Dr. Gaspar is doing these injections in 4 lines along the vaginal canal, separated by 1.5 centimeters, small injections of PRP. Of course, we don't have yet a study which will confirm the contribution. So people knows about positive effects of PRP from other fields, and they assume it is same here. I also assume this. You even have now some producers which are producing like vaginal PRPs or hyaluronic acids to improve some indications without energy-based devices, just using these. But again, it has to be better supported by evidence.
Okay, so we are, our time is running out. So I think
maybe just one comment, Tamer.
Yes, please, yes.
Maybe you were not looking into the chat, but there is one question in the chat or comment in the chat, and maybe I can
really?
answer to it. There is
not aware of that.
Dr.
Okay.
Cecile Gunay. She was asking about G-Runner. She's a user of G-Runner, but she said she cannot find any studies done with G-Runner or comparing studies, disadvantages and so on. So maybe I can answer because
Yes,
we initiated several studies with G-Runner, and they were done. One was done with the stress urinary incontinence. It was presented on ICS Congress several years ago by the team from Mendoza in Argentina, and it will be published. So it shows a comparable improvement and excellent results in reduction of stress urinary incontinence. The other study was done by Dr. Gaviria when he was in Spain, and this study was about all 3 or 4 indications for smooth mode. So he was treating ladies with laxity, with incontinence, and the GSM with the G-Runner, and also had good results. For our users who are registered to LAHA web pages, you can check on LAHA lectures, and there are webinars. There are webinars about use of G-Runner in these indications. You can find it there. We are looking forward to publish these 2 studies soon.
Okay, thank you, Zdenko. Before closing this session, I would like to remind the audience that they will find the webinar in website of Turkish Menopause and Osteoporosis Society. So I would like to deeply thank you, all of you, for your contributions. I really appreciate your contributions. Thank you very much, and hope you hope you be in well health because of Corona.
Thank you for the invitation. Bye bye.
Thank you.
Thank you, Tamer. Thank you.
Thank you, Tamer.
Bye bye to everyone. Bye.
Bye.